When something blocks your body's internal plumbing, it's not just some minor inconvenience, it's a really serious medical puzzle. So today, we're going to open up the diagnostic toolkit that doctors use to figure out exactly what's causing a urinary obstruction. Let's dive right in.
It's a pretty simple question, right? But it gets right to the heart of what we're talking about. I mean, we all get what a blocked pipe means in a house. But when that happens inside your body, it's a whole different ballgame. It's sudden, it's serious, and for a doctor, the real question isn't just if there's a clog, but where is it and what is it? So a patient comes in, the symptoms are all pointing to some kind of blockage in the urinary tract. Right away, that diagnostic clock starts ticking. The goal here is to move fast, but also be incredibly accurate, to get from just a suspicion to a precise diagnosis. Okay, so this is the term we're dealing with, obstructive uropathy. And really, you can just think of it exactly like that blocked pipe we mentioned. Something is physically stopping urine from getting out of the body, and this causes a backup, building up pressure that can make the kidneys swell up and, if it's not treated, cause some really serious damage. To solve this mystery, doctors basically have to become detectives. And their toolkit? Well, it's packed with all sorts of advanced imaging technologies, and each one is designed to uncover different clues about what's going on with that blockage. So, the very first tool that almost always comes out of the bag is the renal and bladder ultrasound, or RBUS. You can think of this as the initial sweep of the crime scene. It's the go-to first-line screening test to get a quick and, importantly, safe look at the big players, the kidneys and the bladder. And the key here is really this trade-off between its strengths and weaknesses. The biggest pro, for sure, is that there's zero radiation. That makes it incredibly safe. It's fantastic at spotting what's called hydronephrosis. That's just the fancy medical term for a swollen kidney. But, and this is a big but, look at the cons. It can't really see the ureters, which are the long tubes connecting the kidneys to the bladder. So it can tell you that there's a backup, but it often can't show you the exact why or where. Okay, so let's say the initial clues are pointing to the most common culprit, a kidney stone. Well, that's when the detective brings out a much more specialized tool, the non-contrast CT scan, sometimes called a CT-KUB. This thing is the absolute gold standard when a kidney stone is your prime suspect. And this table really shows you why it's the gold standard. I mean, its accuracy is just off the charts. It almost never misses a stone, and it won't mistake something else for one. It tells you the stone's exact size, its precise location, everything. The trade-off, of course, is the radiation exposure. It's a calculated risk, but it's used because that speed and accuracy are just so critical in an urgent situation. But what if it's not a simple stone? What happens when the mystery is a little more complex? Well, for those cases, the detective needs to dig even deeper with some even more specialized instruments. These advanced tools are all about answering very specific questions. A CT urogram, for example, uses a contrast dye to basically create a super detailed roadmap of the entire urinary system, perfect for finding things like tumors or narrowed passages. If the problem is thought to be way lower down, in the urethra, a different scan called a retrograde urethrogram is the go-to. And of course, when radiation is a big concern, there's always the MR-based MR urogram, which is a really powerful and safe alternative. And this brings us to what's really the most crucial part of the whole investigation, the strategy. Having a great toolkit is one thing, but the real art is knowing which tool to use and when. That choice isn't random. It's a careful decision based on all the clues you have so far. This pretty much shows the first big fork in the road for the diagnosis. On the one hand, if all the evidence screams kidney stone, the choice is easy. You go with that fast, super accurate non-contrast CT. But if you're on the other path and the cause is still a mystery, you need that more detailed roadmap from a CT urogram to find those trickier problems like tumors or strictures. And here's a really cool piece of logic. The clues from the scans themselves help pinpoint where the problem is. If you see swelling on just one side, that's unilateral, it points to a problem upstairs, in that specific kidney or its ureter. But if both sides are swollen, bilateral, that's a huge clue that the clog is downstairs, maybe in the bladder or urethra, blocking everything up. So, by carefully choosing the right scan and then expertly interpreting those images, all that detective work finally pays off. What started as a suspicion becomes a confirmed diagnosis. The cause is found, and a clear plan for treatment can be put into motion. All right, so let's boil this all down. What are the big take-home messages here? Well, first, imaging is absolutely essential, and it usually starts with that safe, broad sweep of an ultrasound.
Second, when it comes to the number one suspect, kidney stones, the CTKUB is the undisputed champ. And maybe most importantly, choosing a scan is a strategic decision. It's all about tailoring the right tech to the right patient to get the right diagnosis and ultimately the right treatment. And that kind of leaves us with this final thought. These incredible tools give us the what and the where. They give us the hard evidence. But interpreting that evidence, weighing the risks, and connecting it all to a unique person, well, how much of making a diagnosis will always be a fundamentally human art? Something to think about.